So the exercise we're about to do today, if you can notice, we're doing a lot of, my latest videos have been a lot about like isoholds and stability stuff, because isoholds or isometric contractions are a great way to focus on tendon strength, joint stability, and contractile force over time at a specific joint. So if you are someone who is suffering from a tendinous issue, if you have pain in the back, like behind the back of your knee somewhere, or if you have pain at your knee, one of the ways that you can strengthen stuff over time and make your life easier is by doing isoholds to build some resilience, and then start doing harder exercises that require bigger and deeper ranges of motion. The first isohold we're about to do, or this next isohold we're about to do, is a hip flexor isohold. So you take a band here, wrap it around one foot, wrap it around the other, here, drive knee toward your chest. Now a couple things. You don't want to go so high that the hip turns out or any which way. I don't want to see a hike at the hip while I do this, so I'm not like trying to raise this hip up to make that happen. You're just bringing the knee up as high as you comfortably can, and feel that in the hip flexor. You're just going to hold this. At first, you may only be able to do like at the up end of like 30 seconds, but over time, you should be able to do more. Your hip flexors, your prominent / most dominant hip flexors, your iliacus and your psoas, they are inside your hips. You grab your hip bones here and you kind of try to peel on the inside of them. Your iliacus and your psoas are inside there, and they attach inside to your low back. So having a stronger hip flexor can be a safe and effective way to improve low back pain and resilience. Show you that hold from another position. Once again, I'm here. If you notice, should not be any changing in pelvis position while I do this. I'm just coming here, coming straight up. And I would just hold this. And if you want to make it more difficult over time, you can give yourself a little calf raise in there if you're trying to work your ankles or have any ankle issues. But for right now, this is good. Yeah, so this is the hip flexor isohold. Trying to really target the iliacus and the psoas, or iliopsoas complex, if you will. You have other hip flexor muscles like your rectus femoris or TFL. These will probably not be targeted as much during this. Totally okay. We're not worried about those because these do not attach at the low back. In a quick review, your isohold movements, any movement that is done at an isohold will improve your tendon resilience, joint stability, and neuromuscular control. But yeah, I hope you enjoyed this video. If you have any questions about it, throw it in the comments. If you did enjoy the video, please hit the thumbs up button. And if you haven't yet, please subscribe to my YouTube channel.